Every month we bring you a segment with Kentucky One Health, so take a look at this piece. Every month we do a segment with Kentucky One Health called Living Well with Kentucky One, and this month is no different. We're here with Sandy Stevens, who is an RN with Kentucky One. Welcome to Urban Lifestyles.
Thank you.
And this month we're talking about breast cancer. This is a subject we've touched on many times, but this time we're talking about high-risk breast cancer. So can you explain to our audience exactly what that is?
Yes, someone at high risk for breast cancer may be someone who has a family history of a mother or grandmother who developed breast cancer at an early age. She also may be someone who has been already tested for the BRCA gene and is positive for that. So we have just started here a high risk breast clinic for patients who fall into those categories, and they may be referred to us by their OBGYN who has seen them, or the surgeons may have a cancer who it's not a cancer, but it is one that may develop, a tumor that may develop into a cancer, so we'll see them as well. We also, in our clinic, it's been wonderful. We just started it. We have in the clinic we have a genetic counselor that meets with them. We have our medical oncologist, and we also have a dietitian that talks with them about a diet as well.
So what are some questions that you should ask your OBGYN?
Well, if you definitely should ask them, am I at risk? And given my family history, am I at risk for this? We see patients, if you're someone that you feel like you need to see us, we can call our Hope line, which is 502-562-HOPE, and to make an appointment to see Dr. Mondati, who is the physician in the high-risk breast clinic. We also see patients through our surgeons. We get referrals from the surgeons, and then also the genetic counselor who has seen someone and finds that they do have this BRCA positive gene will refer to our clinic as well.
Well, Sandy, how do the treatment steps differ from high risk and traditional cancer as we know it?
Okay, well, the traditional treatments, as far as like the chemotherapy and things like that, the high-risk breast clinic, we can offer chemo prevention, which is different from chemotherapy, but it's to kind of protect someone from developing breast cancer. And we still do, just as if someone did have breast cancer, we still monitor the patient. We have an example of how we work as a team here. We have a multidisciplinary team. An example would be a woman comes to our breast care center, and because she has a lump in her breast, she gets diagnosed, gets a biopsy, gets diagnosed, and it's a lesion which is not cancer but could develop into cancer. So at our multidisciplinary conference, we talk about it, the surgeon takes it out, we talk about the pathology, and then she gets referred to our high-risk breast clinic, where she sees the medical oncologist, and then she sees the genetic counselor, and then she will see the dietitian. And then at that point, we will talk about doing chemo prevention to help prevent that lesion or anything developing again into cancer. And then we will monitor her as far as like doing mammograms and keep in touch with her to make sure to watch her that nothing does happen.
So if I'm understanding you correctly, the advantages of coming to Kentucky One Health is it's a holistic approach.
Absolutely, yes.
So if we were wrapping this up and we're talking to our audience, what are 3 things that you want our audience to remember about high-risk breast cancer?
Okay. That number one, that we do have a clinic here that's just started that we can see you, and it is multifaceted, so that you will be seen by members of the team to kind of watch and keep an eye on you. If you wanted to make an appointment for the high-risk breast clinic, you can call the Hope line, which is 502-562-4370. And we do have a multidisciplinary team so that all of our members talk together and are a part of it. So as always with Kentucky One Health, this is information that you can use, and you can see why it's so important to get your annual screenings. We'll take a quick break and back with more right after this.